Good morning, everybody. This is the first interview by ISSPP website with our invited, Professor Jimiso.
Thank you, Xavier. Happy to be here.
Talking about your experience and your recent studies presented in the first ISSPP meeting concerning the prevention of gastric carcinomatosis with an abundant lavage.
Yeah, I'm happy to be here. This is a clinical trial called ExPeL study, which is a short form for extensive peritoneal lavage for prevention of peritoneal carcinomatosis after gastric cancer surgery. And this is a randomized controlled trial, and it's a multi-center involving 5 countries and 23 hospitals. Our hypothesis is to test that extensive lavage with saline after gastric cancer surgery can prevent peritoneal relapse after radical gastric cancer surgery. And therefore, the study design is a randomized studies. We randomize patients with locally advanced gastric cancer, clinically T3, T4 cancer. That means that a serosal invasion of the primary tumor. And we randomize into 2 arms. The study arm is washed with 10 liters of normal saline at the end of the surgery. And the control arm is no washing. And the primary endpoint of the study is overall survival at 3 years. And we have recruited 800 patients, and we just presented the result, the final result of this study at the recent ASCO GI meeting in San Francisco this year. And now we completed the study with 800 patients, and we randomized equally into 2 arms. And unfortunately, the primary endpoint did not meet. That means that we find that there's no difference in terms of survival between the intervention arm and the control arm. The overall survival at 3 years, both arms is 76% in the study arm and 75% in the control arm. Hence, we concluded that this study that the extensive peritoneal lavage does not prevent peritoneal relapse after gastric cancer surgery.
Just to know about if you had prepared future study concerning this way of trial.
Regarding this, after this trial, because our study is adequate sample size, therefore we concluded this just by simple extensive peritoneal lavage did not able to reduce the peritoneal recurrence. Therefore, we understand that there's a French study called gastric, which is a study looking at the prophylactic HIPET for patients with a high risk of peritoneal recurrence after gastric cancer surgery. And this study is also a randomized controlled trial, and the result we are eagerly looking forward to, and looking at the prophylactic HIPET. On our side, we are now we have a lot of study on pipette, and one of the recent study we are looking at for patients with gastric cancer with peritoneal carcinomatosis is to apply a pipette with immunotherapy. And this trial is we call it a piano study. It's already open for recruitment, and we hope that we will have result soon.
Are you taking something on your mind to see further studies joining other people in the world, maybe in France, maybe in Europe?
Yes, in fact, this piano trial, this pipette together with immunotherapy is a multi-center studies from together with France and also Belgium. Therefore, we are looking at it's a phase 1 study looking at using pipette oxaliplatin together with nivolumab for patients with gastric cancer and peritoneal carcinomatosis.
Can you anticipate some preliminary results Do you expect some modifications on the basic study compared with these new ones?
Yeah, we are excited because this is first in human of
right.
combining pipette together with immunotherapy, because we know that pipette is specific for peritoneal metastasis, and the recent data also suggests immunotherapy is also also have some effect on peritoneal metastasis from gastric cancer. So we hope combining these two modality may have a favorable result for our patients with this condition.
Fantastic. We are really excited to waiting for the results and to see you soon. I take the chance to invite everybody to meet you, to join us with the ISSPP next Congress in Rome 2021. We're gonna launch the announcement, we're gonna launch all the invitations, and I'm sure you will share a lot of your experience with people in Rome. Thank you very much, Professor So, for your time. I know you're a busy surgeon. We know how is it, and thank you for this moment. We really appreciate, and of course, we're gonna meet everybody at the ISSPP website. Thank you, Professor So.
Thank you, Xavier. Thank you. It's an honor to be here. Thank you. Take care.
Thank you very much.
Take care. Take care and stay safe.